Welcome. For those of you just joining, we will get started in about 2 or 3 minutes, just giving a chance for people to continue to join us. So we still have quite a few people joining us. I am going to get started in about 1 minute. So hang tight and I will be with you in 1 minute. If you have any questions or comments before we get started, or you're having technical problems, go ahead and use the Q&A. I will not be able to unmute you. So if you raise your hand, unfortunately, I cannot unmute you. So if you have questions or comments, use the Q&A and I'll be back with you in about less than a minute. Thank you. Okay, welcome everyone. Thank you so much for joining us. I am thrilled to be able to present to you tonight a session on dealing with seasonal affective disorder in the midst of the COVID pandemic. My name is Sandy Kriegish. I am a clinical manager for Homewood, and I'm also a senior account executive. I've been with Homewood over a decade now, and I'm always thrilled to be able to help educate people about mental health. And this is certainly a good time to talk about seasonal depression or seasonal affective disorder. So just a couple of housekeeping items. If you have questions, do not raise your hand, but instead let me know through the Q&A, which you can find in the menu, I believe at the bottom of your screen, but of course that depends on how you're joining us. If it's on your phone, I'm not sure where it might be, but we're going to be together about an hour, and this session is being recorded. So if you are interested in the recording, it will be available in approximately a week, and you will be able to have access. I believe a link will be sent out to you, but also it will be available on our website at some point, and also I believe on our YouTube channel, the Homewood Health YouTube channel. So let's get started. It's a tough time right now for many of us, and we're going to talk about a lot of the things that are impacting us. Tonight, one of the things that we're going to do, I'm going to overview the session here for you. We're going to talk about the definitions of seasonal depression and anxiety. You may be thinking, I thought it was just seasonal depression, the winter blues. But the reality is that depression and anxiety are very linked. And especially right now with the pandemic, our anxiety issues are are sometimes the greatest thing that we're dealing with. And so we're going to talk a bit about that, because we can have both seasonal depression and anxiety. We're going to talk about the prevalence of it, the signs and symptoms of each, strategies for managing seasonal depression and anxiety, and then some resources. So you'll see the objectives here on the screen. Really, to boil it down, what I want you to walk away with are some strategies to be able to manage seasonal depression and anxiety if you are suffering from it, but also if you have a loved one or someone that you know who is struggling with seasonal depression or anxiety. Hopefully you can be a help and support to them with the knowledge that you will gain tonight. So again, just in the midst of a pandemic, most people are feeling some form of anxiety, certainly a greater emotional load, right? So during the pandemic, people are already carrying a huge emotional load. And then some of us maybe have struggled with seasonal depression in the past. And it certainly could be worse this year, given everything that we are dealing with. Of course we're anxious. I mean, you know, it would be kind of abnormal for us not to be anxious in this time of extreme uncertainty and change. And you can see here on this slide all the different changes that we have been dealing with. Certainly you could probably add to this list. You know, workloads have changed or decreased or increased. And you know, for a lot of people, they're like, well, decreased workload so much, but so what? But boredom is just as difficult for many of us as anything else, and can contribute to depression and anxiety. So worry, a lot of us are worrying regularly about not just our own well-being, but that of our family and friends. We're isolated, many of us, and certainly we don't have the social avenues that we used to. And so if you are like me, you're a very social person, this is a big change. So, and then of course, you know, maybe over time we've developed some coping skills that have helped us with seasonal depression or anxiety, but those coping skills were taken away by the pandemic. You know, we can't go on vacation. We struggle to find recreational things to do. Some of our hobbies may have been limited, and you know, can't go to the gym, or just, you know. You all probably can add your take on that. Childcare and or school issues. I certainly hear from a lot of parents, a lot of moms and dads who are really struggling with remote learning for their kids, and that has added huge pressure, but it's also a huge change for the whole family, and the worry about the children. Financial hardships, because maybe people have lost their jobs or they're making less money, job insecurity throughout all of this. And then, of course, feelings of loss. All of the above can create feelings of loss, or, you know, that sort of nostalgia for the way things used to be before the pandemic. But many of us have also lost loved ones to the pandemic, and we're struggling with that as well. So my heart goes out to those of you who have been affected by COVID in your own family. And so, yeah, let's talk a little bit about what seasonal depression is. So you may have heard of it as seasonal affective disorder, winter blues, just, you know, seasonal depression, whatever it might be. But really, it's just another form of depression. It's related to the change in the seasons. And many things impact that. A lack of sunlight, decreased exercise. For many of us, we don't get out as much in the cold weather. Eating habits, you know, lots of different things. But you can see here on this list the defining features of really any depression, including seasonal depression. So of course, a depressed mood, low energy, loss of interest or pleasure, sleep disturbances, difficulty concentrating, and feeling hopeless or worthless. And then if you add to that some of the symptoms of just seasonal or winter pattern depression. Oversleeping. Some people just sleep and sleep, they don't want to get out of bed. Overeating, particularly craving for carbs and sweets. I can identify weight gain, which can come with craving for carb and sweets, but also lack of exercise, things like that. And then, of course, the social withdrawal. But, right now, social withdrawal is almost forced on us. So, but often we feel like hibernating. And these are pretty specific symptoms to a winter pattern of seasonal affective disorder. There's also a spring-summer pattern. Some people actually become more depressed or anxious in the spring-summer. And that has a bit different set of symptoms, but we're going to talk mainly about the winter pattern today. So again, just some of the other signs and symptoms. You can see here the list of physical symptoms, sluggishness, restlessness. We've talked about the weight change and difficulty sleeping. Cognitive changes include impaired concentration, indecisiveness, feeling worthless, guilt, thoughts of death or suicide in an extreme form or a severe form. Behavioral changes, withdrawal, avoidance, isolation, which many of us are not choosing right now, and then the emotions that go along with seasonal depression, including, of course, sadness. But you can see there also associated are anger, irritability, shame, and guilt. So think about it. If you're sad and depressed, often that will bring about irritability. You snap at others, then you feel guilty, feel ashamed. It all starts to make sense. Forgive me, I have a bit of a tickle in my throat. Tends to come with this season for me. So I'm gonna have a lozenge here. So hopefully I will not cough too much on you. So let's talk a bit about anxiety. We're going to make sure that right now, a lot of people are struggling with anxiety who maybe have never struggled with it before. It is a universal human experience. It's a normal emotion, and it's our reaction to danger or perceived danger. And so part of the problem is, let's imagine that we have a black bear coming at us. Our biology says we are going to have a fight, flight, or freeze response to that kind of intense danger. What happens is over time, if we have multiple events where we perceive a level of danger, whether it's there or not, that's when our anxiety really stays at a level that is not healthy for us. It really is an adaptive response, but over time it becomes a maladaptive response because the danger is not real. And even if the danger is real, it's in a form of uncertainty, and yet we imagine that the worst thing's going to happen. So the quote down below, there are times when world events bring forward even greater uncertainty in daily life, which in turn can make us even more anxious than usual. The coronavirus outbreak is one of these times for many people. As clinicians, we are seeing a lot of people struggling with anxiety right now, even more than seasonal depression, which is interesting. I'm seeing a lot more children with anxiety, a lot more teens and young adults with anxiety as well. So some of the signs and symptoms of anxiety beyond what we've talked about. So you've got an increased heart rate sometimes, chest tightness, difficulty breathing, dizziness or sweating, worry, obviously. So I've talked a bit about worry. I want to talk about what if for a minute. So worry is often in the form of what if this happens? What if this horrible thing happens? What if my mother gets sick with COVID and dies? What if, I lose my job? What if? It's a very understandable and normal thing to worry right now. However, what I often said to clients in my private practice is that we spend a lot of time what if the negative. What I want you to think about is, can you what if the positive as well? This is much harder to do, but when you're worrying about something bad happening, you really need to, counter it with, what if that doesn't happen? Or what if something good happens? What if my child is actually learning more um, about life in remote learning and during this pandemic than if they were in school? What if not being in 3 sports is actually lowering their anxiety level? Or so a lot of things that I would encourage are just to think through, okay, so what if this bad thing happens? Well, what if good things happen as well? And so try to counter that. We'll talk more about some of the tips and tricks as well. Behavioral signs and symptoms you can see there, and then of course the emotions that are a part of anxiety. So just wanted to list the types of anxiety disorders because many people might not be aware that there are many different types of anxiety disorders. The one in the middle, the generalized anxiety disorder, is often what people think of. When we talk about generalized anxiety, that means the anxiety is pervasive pretty much all the time. You worry about every situation. You're doing the what ifs all day long, and it's very hard for you to relax, lower your tension levels, lower your stress levels. So of course, then there's also panic disorder. People who have ever endured a panic attack know what I'm talking about. And that is a difficult form of anxiety. Agoraphobia is, it's a combination of fears. It's fear of wide open spaces, fear of a lot of people, fear of crowds, so there are a lot of phobias in there. Social anxiety disorder is fear of social situations and being embarrassed or feel like you're not sort of measuring up. Specific phobias like flying or snakes or things like that, heights. Post-traumatic stress disorder, obsessive-compulsive disorder, and the last one, adjustment disorder, are no longer actually considered anxiety disorders according to our diagnostic manual. They are part of, actually they're sort of on their own in separate, but it really doesn't matter. They are still very much rooted in anxiety. And when you have a trauma happen to you, PTSD, a lot of people understand what that is nowadays. Obsessive compulsive disorder, in case you're not familiar, is when you have obsessive thoughts that you can't turn off, or compulsive behaviors or actions, such as washing your hands constantly, or you have to do a certain ritual before you leave the house, or you believe something bad will happen, things like that. Okay. So again, if you have questions or comments along the way, feel free to use the Q&A, and I will take a break every once in a while and try to answer those. So let's talk about the prevalence of anxiety and seasonal depression. For a 12-month period, about 12% of us will experience anxiety issues. I have to say that probably during pandemic, it would double or maybe even triple, depending on level of anxiety. In a lifetime, about 25% of people will struggle with an anxiety disorder. For seasonal depression, it's about 3% of us that might, in a 12-month period, experience seasonal depression. But in a lifetime, it's about 15% of us. And then, of course, I think I mentioned that anxiety and depression are inextricably linked, and they often co-occur. You can start with anxiety and end up depressed, and vice versa. So there's always a co-occurrence, not always, but there's a high percentage of co-occurrence with the two. So a lot of people want to know, where's the line between normal and not so normal. I don't love the term disorder because it has a negative connotation more so than it really should for the actual definition of the word. But so you'll hear me say issues or something like that. But really, it's when we consider it to be something that you might want to seek out professional help is when the frequency is more often of the symptoms. The duration is longer term. So for depression, maybe greater than 2 weeks, you're experiencing depressive symptoms. For anxiety, it's maybe several months. I believe generalized anxiety is 2 months you're experiencing those symptoms. And what we do as clinicians is we actually have criteria that you would meet or not meet based on those, diagnoses. Pervasiveness, how much is it pervasive through your life? Is it just in one situation? Is it just that you have a fear of flying? Or is it that your fear of flying has morphed into many different fears? And so is the anxiety or the depressive symptoms, are they everywhere in your life, or are they only in 1 or 2 situations? Intensity, of course, if it's stronger or more severe, that would be on the disorder side. And then impact on daily functioning. As clinicians, we look at this probably more than anything else. How much is what you're struggling with impacting your daily functioning? So if you've got, if it's impacting your work, if it's impacting your relationships, if you struggle to get out of bed, or you can't sleep at all, or if it's impacting your health, all of those are things that we look at in terms of the impact on daily functioning, and look at severity. So we're going to talk a bit about how to manage a lot of these symptoms. And really the goal, right, is always symptom reduction. And for anxiety, I want to just talk a bit about what Anxiety Canada suggests. If we have US people on the call, that's great. These are sort of generic for everyone. It doesn't have to be, I'm sure that if we looked it up in the US, they would say the same things. So number 1, self-compassion. So during these uncertain times, we have to have a lot more compassion for ourselves, especially those of us who are perfectionists. And we really struggle to feel good about not doing something exactly right. And so self-compassion is something that, if you're interested, there's so much research and writing about this out there. There's a bit of a trend in learning more about self-compassion, but really it's allowing yourself to have compassion for whatever it is that you're dealing with, and whatever you're feeling, whatever you're displaying in terms of behaviors and things like that. So the other thing that we suggest is that you limit your news consumption, and also unplug from social media. I have to say that this year especially has increased my anxiety as well. And I found that my anxiety was spiraling more when I was reading and getting pulled into social media. I've also kind of limited the news that I watch as well, because these are all things, while, we feel like we need to know what's going on, and we have that fear of missing out, FOMO, is that what they call it? I find that unplugging from these things helps me to feel less anxious and more grounded. And the research shows that that is true for many people. So I highly recommend that you limit those things. And practicing awareness and acceptance of emotions, you can get some great instruction on this by learning about mindfulness meditation. But one of the things that really exacerbates anxiety or depression and can actually create it is the idea that we're feeling negative emotions and we don't want to, so we push them away, or we put them into a box, and then we put the box on a shelf and hope that there you go. I don't want to feel that anger or that sadness or that trauma ever again. And that is not healthy for our mind, for our brain, for ourself. And so we need to be able to live with and accept those negative emotions, and we might need some help with that sometimes. So other things, protecting yourself, sort of putting a force field up at times when you're feeling like other people's stress and other people's anxiety is impacting you. And then, of course, gratitude. Many of you, I'm sure, might already be doing some form of maybe a gratitude journal, or just jotting things down, or thinking about gratitude at the end of the day. But I highly recommend that you even think about scheduling time, 15 minutes throughout the day to spend just thinking about the things that you are grateful for, maybe some of the positives. And if you struggle with that, think about maybe people who have made a positive impact on you for the day, for the week, for the month, and then making sure that they know that and expressing that gratitude. So you're not only lifting others up, but you're lifting yourself up at the same time. And I know that many of you can relate to that. Okay. So supporting yourself and others right now is super important. Self-care, if you never have had to have a plan for how to take care of yourself, now might be a good time to think about it in the midst of this pandemic, because so many of us are struggling. Like I said, the emotional load is so high. Your sense of well-being can definitely be affected by the social isolation. And, it really takes a toll on many of us. And so we have to find ways to try to fight that and connect with people within the constraints that we have. We may have an increased or unfamiliar workload. We may have had to change some things because of COVID, financial hardships and concerns. So one of the things that I would suggest, since this isn't necessarily a session about self-care, but we did actually do a session on self-care that you have access to. So I just wanted to share that with you. If you want to go to Homewood Health's YouTube channel, or, and I'm assuming most of you are covered by Homewood Health Employee Assistance Program, you would have access to our previous public webinars by going to the website. So you can access it either through homewoodhealth.com or our member area, which is homeweb.ca. So just thought I would mention that if you want to learn more about self-care. I think right now we need to check in on each other, on our coworkers, on our friends, and our neighbors who might be struggling. And I know it's hard to tell sometimes, right, whether people are struggling, but don't just do the how are you, because often we're just so used to saying, oh, I'm okay, I'm fine. You might want to follow up with, no, how are you really? And hope that others will do the same for you, because it gives us a chance to really share this human experience that we are enduring. And even though we all feel very isolated in the midst of it. So sharing with others and knowing what others are going through can be helpful. So we're going to talk a bit about some of the ways that we know and research tells us, and treatment programs tell us are effective in dealing with seasonal depression or anxiety. Some of you may be familiar with CBT. It's actually short for cognitive behavioral therapy. It is something that clinicians use, but it is also accessible to people without going to counseling in many ways. Let me explain it to you for a minute, because this is one of the most effective things for seasonal depression, really any kind of depression, and for anxiety. So let me give you an example. The way that, so let's imagine you're in a situation. The situation could be maybe you're at work and you just got criticized for not doing something quite right. So that's a situation. From that situation, you think about what happened, right? Afterwards, you're thinking over and over. You may not even be aware of the thoughts that are in your head. what's a typical thought after you've been criticized? For someone who's depressed, it could be, I'm not good enough, right? I'm just not good enough for this job. And then you think, your thoughts then create feelings. So situation, then you think, and then it creates feelings. What are you feeling then at that point? Worthless, anxious, maybe fearful for your job. So then your feelings create behavior and physical symptoms. So that's really how what we look at in terms of the cognitive behavioral therapy model is, you've got a situation, but somewhere along the way, whether it's we change your thoughts or we change your emotions or we change your behavior, we can change that cycle. And you can interrupt that and learn new thought patterns, learn to change what you do, even if you're still thinking the same thing. So whatever you change is going to change the cycle. You're going to learn new coping skills, and that is cognitive behavioral therapy. So like I said, the goal is to learn new skills to manage whatever the symptoms are, but it's often it's that self-talk that's getting in our way, and it's what we tell ourselves about situations. And so we can learn. It does take time and effort often to change those. I mean, many of us have had the same thought patterns and thinking traps for decades. So it does take practice. And that's why often seeking professional help can be, a good reinforcement or accountability. But and of course, there have to be ways to keep yourself motivated as you're changing, and so often weighing the pros and cons of changing versus staying the same. How is this impacting your life? How do you want the future to be different, and what does the solution look like? So these are things that we work on in cognitive behavioral therapy. There are many strategies that we employ as well, and I'm not going to go through all of them, but here are 3 that I just want you to maybe learn a little bit more about. 1 is getting informed or educating yourself. 2 is healthy thinking. And then the 3rd one is emotion management strategies. So we're going to talk about each one of those real briefly. Again, if you have questions, feel free to go to the Q&A, which I think you can access at the bottom of your screen. And feel free to make comments or ask questions, anything that that you want to share. I believe most of the questions I am the only one who sees, but anyway, let's talk about getting informed. So whenever we have more information about what we're feeling, what we're dealing with, whenever we realize that given circumstances and given what we're dealing with, it's normal, that our brain is actually doing what it's meant to do in these situations. And then, of course, knowing that effective treatment is available. There are actually 3 different, well, and possibly even more than that, but 3 main treatments that can help lessen symptoms of seasonal depression. And cognitive behavioral therapy, sometimes called talk therapy, is one. The second is medication. And the third is light therapy. So there are lights that are made specifically for seasonal depression that don't have UV light in them. And they're meant to lessen the symptoms of seasonal depression, which is often caused because of lack of light, which then leads to other things. So just I wanted to mention that. It's in a future slide, but those 3 ways are effective ways to lower the symptoms of depression and anxiety. I do want to mention, though, the light therapy, it can be very effective for lessening symptoms during the winter or the season that you are struggling. The thing about cognitive behavioral or talk therapy is that it lasts longer than that season. You're learning skills for the future, for a lifetime, instead of just using light when you need it. But they can both be very effective, and you may want to use them in combination as well. And I'm certainly not against medication if that is, it often helps many people. And so that's also something that you want to, talk with your doctor or talk with a therapist about. Recognizing symptoms. So of course, one of the things that we do in cognitive behavioral therapy is a whole lot of observation of the self-talk, of the behaviors, that kinds of things. There are facts versus myths. So we will challenge a lot of beliefs in cognitive behavioral therapy. And let me give you a couple examples of some typical myths that people believe. So first off, one is the causes of anxiety and depression are usually rooted in childhood. So effective therapy must focus on that period of time. That is a myth. We have learned much over many decades that you don't have to lay on a therapist's couch and talk about your childhood. It is actually much more effective to stay in the here and now, to deal with what's keeping you, what barriers are keeping you from being where you want to be now, and coming up with solutions. So it's really about learning new skills to manage your thoughts, emotions, reactions, and things like that. One more myth for you before I move on and actually answer some of your questions. If you have an anxiety disorder, it's important to avoid stress and situations that make you feel stressed. That is a myth. So it's very common, and it's probably it's much easier to do when you're anxious to avoid these situations. But treating yourself like you're fragile and you have to avoid those risks actually leads to feeling worse. You can often feel demoralized. You can actually reinforce your anxiety, and you and it can ramp up. So you can be anxious and still do what you need to do, feel the fear and do it anyway. And if you feel like you need some help in doing that, that's where reaching out for professional help might be really key. Okay, so I see a couple questions here I'm going to answer. Can you recommend a good light therapy lamp? I don't have any specifics, but I can tell you that if you were to search on the internet for light therapy for seasonal depression, you will find many options. I believe there's some sort of, you want to look for something that is about, I want to say 10,000. I'm not sure if it's BTUs. I always forget the measurement, but there are some really good options out there. And lumens, thank you. Thank you, Celia. 10,000 lumens. So yes, you want to look for something like that. You want to make sure that you stay away from UV light. And I also want to let you know that when you are considering light therapy, don't just rush into it. You may want to talk to your doctor. Make sure that you're not on any medications that actually increase your sensitivity to light. But it is fairly safe. The only side effects I've ever heard of are, unless you're on a medication that you shouldn't use light therapy. Some people might get headaches at first. Some people might, get eye irritation or soreness, but most people do great on light therapy. 20 to 30 minutes a day, best in the morning, most of the time. So yeah, I don't know if any of you have ever used it, but it is, it can be very helpful. Yeah. Especially in these gray days or, the really dark days. So Someone asked, does supplemental additional vitamin D in your diet have the same effect as light therapy? So there's been a lot of research that lower levels of vitamin D might actually be triggers for seasonal depression. I would highly recommend that if you haven't, you see if you can get your doctor to test you for your vitamin D levels, because if you are low, just supplementing with a regular dose of vitamin D isn't going to raise your vitamin D back up to a good level. But I highly recommend, I mean, I'm not a doctor, so I can't tell you. I take vitamin D every day, and I think that this time of year, anyone far away from the equator should consider it, because we don't get much light, and we certainly don't get as much sunlight as we need. Whether it's as good as light therapy, I don't know. But certainly some people might feel that getting additional vitamin D really lessens their symptoms. So someone asked about the use of CBD oil for anxiety. This is another one where the research is mixed, and the anecdotes are mixed. So it may work great for some people and it may not. I think it's always worth a try, but it really just depends on the person. And you might want to do some reading up, talk to your doctor about what dose of CBD as well, because you know that is something that comes in a million different iterations as well. So so yes, Celia, you must you've got some great information on light. So Celia recommends if you use a light for light therapy, you only use it in the morning because it can prevent you from being able to fall asleep. So some people do find that the light, if they use it in the morning, it gives them energy, and that if you use it too late in the day, it could interfere with sleep. So you definitely want to take that into consideration. Thank you so much. Nadia says Costco has good ones. So what medications or class of medications have proven most effective in dealing with depression and anxiety? So again, I'm not a doctor, I'm not a psychiatrist, I don't prescribe medications, but certainly as a clinician, I can tell you that the class of antidepressants called SSRIs are most commonly prescribed for depression and anxiety, and there are so many of them out there. Anyone who's ever tried to find the right antidepressant or anti-anxiety medication knows that it can be a period of trial and error to find the right one for you. We are all different biologically, and so but you would definitely want to talk to your doctor or your therapist just to talk through the options. I do know that some people do get prescribed what we call benzodiazepines for anxiety. That's something I would seriously caution people to be aware that if you use those on a regular basis, there can be some, well, for both depression, antidepressants and anti-anxiety medications, there can be withdrawal symptoms, but there can be some additional severe ones for benzodiazepines. So I just want to make sure that you all talk to your doctor and get a professional opinion on those medications. I would also just urge you to maybe steer clear of the supplements that can be often touted as antidepressants, things like St. John's wort and things like that. They may be useful for some, but they can also be harmful for others. So again, talk to your doctor before doing any of that. So yeah, again, a comment, vitamin D wasn't enough for me. The light therapy made a huge difference. I use both, the vitamin all year and light in the winter. Fantastic, thank you. Okay, so keep sending the questions and comments. We are about 15 minutes yet to go, and so I'm going to move forward. But let's talk about healthy thinking. Oh, so Marianne, I see that you raised your hand. if you have questions, you'll have to use the Q&A. Unfortunately, I'm unable to unmute people. You're all muted automatically by the webinar. So my apologies for that. Okay, so another method that we use in cognitive behavioral therapy is looking at healthy thinking. So we want to change from unhealthy thinking to healthy. Stop and observe the unhealthy thinking and describe it. So often you will do a lot of journaling in cognitive behavioral therapy. And be a scientist or a detective. I always say that if you've got a thought or a belief, you want to say, okay, is it possible that this is not the truth? Is this possible that I believe this, but is there a possible other explanation? Are there any alternative explanations for this? So you want to be a detective and develop helpful coping thoughts. So talk to yourself as you would a friend. I don't think most of us would be as condescending, demeaning, and sometimes even just super hard on ourselves if we were talking to a friend or a loved one. So it's important for us to think that way. But again, these are just examples of some of the things that changing, cognition and behavior can be helpful. Emotion management strategies. So again, in terms of managing emotions, we want to make sure that we're not just avoiding negative emotions. We have to learn how to tolerate negative emotions. Otherwise, they're in that box that I mentioned earlier, and the top of the box flies off because we've stuffed it so full of all of our negative emotions. And that's often where depression and anxiety originate, is not dealing with those negative emotions. Certainly there are a lot of other factors, but not dealing with negative emotions is never good for our psyche, at least on a long-term basis. Sometimes we have to, just to get through. Any of you who are healthcare providers certainly know that if you attended to all of your negative emotions throughout this horrible pandemic, you'd probably be falling apart every day. And so, but we need to find time or a safe space to deal with them afterwards. So, and speaking of, I think we have a webinar coming up on that at the end of the month. So look for that as well. I'm sorry, just for healthcare providers. So yeah. The other thing you want to do is prepare for the times that you do have extreme emotions. So for example, if you know that you tend to get angry, or when you feel angry, you want to lash out, you want to yell at people, you want to realize that emotions are reactive. So what will you do instead? How will you not react? And think about maybe doing the opposite action. So for example, if I want to yell because I'm angry, maybe before I have this plan that every time that I feel like I want to yell, I'm going to do something different, like whisper, or I'm going to just walk away. So you decide, what those actions are, and then hopefully execute that plan. So those are just some examples of ways that you can work toward lowering your symptoms and managing emotions. So we talked about light therapy, routine regulation. Routines can be very helpful, especially for people who are anxious. Physical activity. We know, right? We know we should be exercising. We know that it's good for us. And it's so hard right now. Many of us do not love getting out in the cold in winter, and so our activity levels go down. But if there's one thing that I can tell you, is research proves almost as good as any of the other three things that I mentioned in terms of helping lower symptom levels. It's physical activity. So get out and walk the dog, just go for a walk, or make sure that if it's a sunny day, you are at least you're not just sitting inside with the blinds closed, and you're getting as much of that light as possible. Sleep is key, and I have to say, of course there's a term right now, I don't know if you've heard it, COVID-somnia. So many of us are filled with worry and anxiety and uncertainty, and it's affecting our sleep. And so sleep hygiene is really key. If you have not educated yourself about how to get better sleep, it can be life-changing. And I would highly recommend that if you're not getting enough sleep for you, and that depends. I'm someone who, if I don't get 7 or 8 hours, I'm getting sick, or it's catching up with me down the road. And so you have to know what's right for you, and then you have to figure out a way to get it. And I realize that's easier said than done, but work toward getting more sleep, and find ways. One of the theories as well in the research about seasonal depression is that it changes not only our serotonin, which is a neurotransmitter in our brain, but the melatonin as well. So melatonin can be very helpful for people sometimes before bed, and that's a supplement. I normally don't recommend supplements, but this is one that is, very safe. And again, I would talk with your doctor before trying it, but many people try melatonin, and it can help. Because it's something that your brain needs. And if it doesn't have enough of it, sleeping is difficult. Healthy eating. I know right now I'm craving carbs. I'm craving sweets. Yesterday I wanted to make peanut butter cookies. I opted not to. It's very difficult, and I understand that. But the more that we can eat healthy, the more we will feel better and have the fuel to fight these depressive and anxious symptoms. And then, of course, mindfulness and meditation. If you don't meditate, now might be the time to start. And there's no wrong way to meditate, but I recommend that you just look into maybe some of the free meditations out there. Both of the apps that I have used in the past are offering free meditations during COVID. So they both have a list of meditations that you can access for free. And those apps are Headspace and 10% Happier. I think it's called 10% is the app, but it's 10% Happier. So those are two that I know are offering free meditations. If you've never tried it, it can make a huge difference. I know that I've increased my meditation time a lot lately, just because of what's going on, and it can be so helpful. All right, gonna just see if we've got some more comments or questions. Blue light are really good for the kids. Okay, that's a good comment. Used every morning with your kids during school hours at morning. So yeah, I've also heard about blue light. You might want to look into both. And some of these lights will do blue as well as white light, or different tones. And so you might want to look into that. How do you recommend to learn about sleep hygiene? Aha, good one. We've got some great information on our website about sleep hygiene. You can also just Google it, and you can find a lot of really great tips and tricks. There are some sleep societies whose goal is really just to help us figure out how to sleep better. So yeah, absolutely. Not just more sleep, but better quality sleep. Yeah, absolutely. Okay, someone said definitely talk to your doctor about melatonin first. They had a bad reaction to it. So yeah, I mean, any supplement, they're really not well studied. And so I think it's really important to make sure that you're careful with anything like that. Mindfulness, meditation are super helpful for our kids too. Yeah, so true. I mean, if you can get kids started early with meditation, it can make a huge difference. We're seeing so many more millennials, Gen Z, and younger with anxiety and depression issues. And so if you can get your kids started on a great path to meditation, and really just, that centering and quiet meditation, that can really be helpful for them as well. Okay, I think I've gone through them all. We've only got a few more minutes, so let me just see here what else we've got. I wanted to mention a couple of great resources, and then I've got a a slide at the end with just some website resources for you. But if you're covered by Homewood, wonderful. You've got access to all kinds of our resources, free counseling, free coaching resources and things like that. I also want to mention on our website, stop me if I've said this, but I believe that I haven't said it yet. On our website, we have a cognitive behavioral therapy program that is self-directed. It is called IVolve, small I dash V as in Victor, OLVE. So that is a self-directed cognitive behavioral therapy program on our website. You can access without having to speak to a counselor or anything like that. But for those of you who have friends and family who are not covered by Homewood, I want to make sure that if you are Canadian, you will know that there are resources available to every Canadian right now during this pandemic. It's called Wellness Together Canada. Homewood Health is a proud partner. We actually provide some of the counseling resources for this program. You can get free mental health and substance use support through this program. Anyone living in Canada can do that. So there's the website there, wellnesstogether.ca. There's the phone number. Share it, please, with people who you know might be struggling, or just we all need support right now. So share it with everyone, and especially those who are not covered by Homewood, so they know that there are some resources out there. Sorry. Also want to let you know, here's Homewood's phone number, Homewood's website. I want you to remember that these are services that are available to many of you. If you joined us because you are a client or customer of Homewood, this is really important also for you to know and understand what your benefits and services are. Okay, just gonna flip through and make sure that I'm not missing any other questions. Will you provide the links, please? I'm sorry, Laura. Links. Links to some of the, maybe the resources at the end. For iVolve. Okay, sure. Yeah, so again, all you need to do to get to iVolve is go to Homeweb, so HOMEWEB.ca. That's our member site. You can also get to it through this homewoodhealth.com site, and just go to the member services or the member area. So, and then search for iVolve, or you can also search for cognitive behavioral therapy, that kind of thing, and it's in there. So finding the difference between putting emotions in a box versus experiencing them but not dwelling on them, hard to distinguish. That's a great comment, Julie. You're so right. Yeah. It's one of the reasons why I think professional help helps a lot, because those nuances can be it can be great to access a professional. Best time for meditation for kids. Whenever they're feeling stressed or anxious, get them started right away in the morning, maybe with a morning meditation. But I also find, for me, one of the ways that I sleep better is I actually access on the 10% app. There are some really good meditations for getting to sleep. So they just kind of put you in the right frame of mind. But I'm not getting a kickback from any of these apps. I just wanted to mention them as resources. So, and then of course, here's a whole list of other resources in Canada, outside of Canada. There are a lot of great US resources if you're one of our US customers as well. So feel free to access any of these. We've used many of these in putting this presentation together. But any other questions or comments? I will stick around for a few minutes and just go through these. Again, for those of you who didn't hear me at the beginning, this is being recorded and you will have access to it. So in about a week's time, go ahead and look for that in your email and also on our website. So, okay, wonderful. So hopefully you've been able to gain a couple of good pieces of information, something that might be helpful for you or a loved one. And again, we're all in this together, but we are not all in the same boat. Some of us are, treading water alongside the boat at this point and really wondering if we're ever going to make it in the boat. And so I want you to know you're not alone, but your experience needs your story. If you feel like it needs to be heard, then reach out to us. We're here to help. We know this is a very difficult time, and we all need to take care of our mental health throughout all of this. So have a great evening, and it's been a pleasure being with you all. Thank you so much. And I look forward to our next webinar, hopefully together. Thanks so much. Take care.